have more money, more resources, more technology, more wherewithal. We can go to the moon, but we can't find a way to insure 47 million people.
If somebody is working and they have a minimum wage job, that does not pay for medicines, which are so expensive.
It kind of makes you feel kind of, like, gosh, people just don't care if you live or die.
As I've said before, and as all Americans know, our healthcare system is broken. It's unsustainable for families, for businesses. It is unsustainable for the federal government and state governments. We've got to get this done. We've got to get it done this year. We've got to get it done this year.
This little metropolitan 40,000 people, and we have the worst health care coverage in the nation. One thing it's telling you is that jobs are not providing it. Number two is telling you that if they do provide it, you can't afford it. I mean, what is a man supposed to do when his daughter's sick, his wife is sick, he don't have health care?
Well, we went through our own recession about 20 years ago where a lot of businesses closed down. So people that are working here now that have taken other jobs do not make a high hourly wage. We also are a very high agriculture area. Well, farming is seasonal. So they'll make their money per hour in the season, but what do they do after that?
I only make $10 an hour, and right now, since the economy like it is, we don't get maybe 32 hours a week. The man says he can't afford to give us health care because it's so expensive. And I'm a diabetic, and I had to find somewhere to help me.
They make too much maybe for Medicaid, but they don't make enough to buy insurance. They really are the working poor. And so they'll come here and they can afford, some of them from $10 to $25. We have a sliding scale. But some people at $10, it is too much for them. When people go to work every day, they should have means to health care.
I have to come about every week, every other week, but I have to buy about 10 different prescriptions.
You're actually going to stop this one, okay? And then you're going to do this one instead. Is that okay?
They get me help on my insulin. If it wasn't for that, I couldn't do it. I'd be just tough shape. I couldn't even get a prescription. Because if you go to a doctor, they're going to charge you high. And you don't dare go to the hospital out here. If you ain't got insurance, they won't do nothing for you.
I had a stomach bacteria, and it caused me to have an ulcer. Originally, my wife and I, we just took some home remedies trying to take care of it, but it just wouldn't subside. I wanted to go to the hospital, and I put it off because I didn't have any insurance. And I didn't want to put any more bills on my family. We're already on a budget in our home. If I go to the hospital and I get a bill for $1,200, I told myself, I said, nah, I'm going to stay home. Because the money that we have now, I need that to make our house run. And school's coming up. I'm going to need that little money we do have to put our children in school. So I stayed home and suffered. The longer I stayed and tougher it out, the sicker I got.
He was so much pain one day, he was like, just take me on out of here. I said, oh no, you're not leaving me here with these children.
Yeah,
I was messing.
I mean, I was in so much pain, I was crying.
Yeah.
I was crying.
You get aggravated and you just want to quit. Finally, you got where you get your prescriptions for $4. That was a lot of help. And then if I didn't, sometimes I went without because I couldn't afford it. Because my kids come before I do. Always. Do whatever it takes to take care of your family.
The healthcare thing, our children don't even realize that, what we're going through. We don't even let them know what we're going through. We live with it. Okay, we live with it. It's reality. And we just find means and ways to work around things that we need.
I got a lot of home remedy books.
Right, we got home remedy books. We've had to get on assistance.
Yes.
You know, life has a way of giving you a bad hand, but, you know, it's the way we look at it. The cup is not half empty, it's half full.